All right, pooling layers. So a very important topic, especially for all of you who are looking to be the human in the loop. So pooling loops are essential components of convolutional neural networks, and watch the previous video to understand all about what are convolutional neural networks. And pooling layers are commonly used in deep learning for image recognition, CAT scans, X-rays, and processing of these images. Now, let me give you an example. Okay, so imagine that you are trying to describe a busy street scene to someone over the phone, right? So you wouldn't necessarily list every single detail, every single pebble on the road, every brick that you see on the building. You wouldn't do that, right? Instead, you will summarize the important aspects, right? So you will say there is a red car turning around the corner, and a group of people crossing the street, and a tall building in the background. So now, pooling layers in convolutional neural networks (CNNs) do something very similar for images. They basically help the computer summarize the information it extracts from an image, focusing on the most important features and discarding the less important ones. For example, if you look over here, this is the original image, and after pooling, it converts it into a smaller feature map or image that basically has all the information that you need to read that image. All right, so what is the real benefit? Why do we actually do this? This helps the computer actually summarize the information that it extracts from the image, focusing on the most important features and discarding all the less important features. Now, this makes the computer's job easier, basically allowing it to process the information faster and become less tedious, or something we call in machine learning called overfit. Now, what is overfitting? Think of it like a student who memorizes every answer for a test, but doesn't actually understand the concepts, right? So just a guy who can memorize everything, doesn't understand anything. So if they get asked the same questions, they will do great on that specific test, but they will struggle when faced with new questions. So similarly, an overfit AI model learns training data really well. If you give it just the training data, it will do really, really well, including anything that may be irrelevant. It may be noise, of course. You know what noise is. Noise is irrelevant material in any situation, right? But this model that overfits, or basically knows its training data really, really well, but cannot do anything else, when it comes to some other piece of information, or it has to read or analyze some other different type of image, perhaps, it struggles to make accurate predictions on all these new unseen images. So this is what is called overfit, and pooling helps prevent against overfit. Okay, imagine that you have a detailed drawing and you want two outcomes, and these both are your different AI models, right? So let's say this is your drawing right over here. You can see it has well defined that this is written business over here. This is a laptop. You can see all the keys. You can see this drawing on this notebook. And so it's very detailed. And you have this calculator right over here. You can see everything, right? However, you want, by pooling, you say, okay, I only need the margins, I only need the broad details, and that's it. I only need the margins, the most conspicuous things. That's all I need to know. And this is what you would get with a type of pooling called max pooling. Okay. And let's say, for example, you said, oh, I don't need the margins. All I need to know is what's the average color in this whole picture? What's the average color? And let's say we have the brown and the white, and we get the, let's say, a light brown color. And this is called your average pooling. All right. So this is giving you an example of what pooling does. And now you can probably see a little bit how this will affect a clinical model. Is this model used to detect, blood vessels, highly circumscribed swellings or organs, or it just gets a regular lay of the land of the image? Let's talk about this a little further. Now, as we discussed, there are two main types of pooling: max pooling and average pooling. Now in max pooling, the computer, your AI, picks up the highest value within that window and uses that as a summary, like I showed in my hand drawing. As you saw over here, this was max pooling. This is like focusing on the strongest signal, or the most prominent features. For example, in a CAT scan, for instance, max pooling might pick up sharp contrast of a tumor, and basically discarding the less significant variations that may be around it. So you can see this example of max pooling, that the tumor is very prominently picked up, and you can see the high definition and the sharpness of all the other anatomical features that you are noticing. Now, then you have average pooling, and instead of picking up the highest value, average pooling calculates the average of all the values within that window. And this ends up giving a generalized summary of the information in that area. And for example, in medical imaging, average pooling might be used to understand the overall tissue density. As you can see, the image is not as sharp and the colors are not as prominent. So basically, choosing between max pooling and average pooling, this isn't just a technical detail, this is a clinical decision. So if you are selecting a vendor, perhaps, let's say you choose max pooling, you are telling the vendor and or the program, your AI program, you are telling the AI program that you want to prioritize the most intense features in each part of the image. Now, you are the clinician, and the image has been obtained, and you are telling the computer, it's not that you have to go talk to the radiologist, and you are suspicious, okay, I think this patient probably has a tumor. So you will set your AI to max pooling, and you will say, give me the tumor. I want to find the tumor. That's what I'm looking for. And in the future, you won't be your own radiologist, but the AI will be your radiologist, and you will be adjusting the AI to look for what you want to look for. And then if you choose average pooling, you are telling the AI to consider a more balanced view of the features in that particular image. So you see, in clinical practice in the future, different medical tasks will require different approaches. And sometimes finding the highest signal, like the edge of a tumor, is going to be the most important thing for you at that moment. Other times, understanding the overall tissue pattern is more important, and the choice of the pooling method affects how much detail is kept and what kind of information that the model prioritizes, ultimately influencing the model's ability to diagnose and analyze medical images. Now consider a CNN designed to detect early stage lung cancer on CAT scans. Now, if you have aggressive pooling set up, right? If you have set the AI for aggressive pooling, that might help the model run a little faster. But it might also cause the model to miss many small nodules that are just beginning to form. This is where your clinical expertise becomes absolutely essential. You need to understand the trade-offs inherent in these different pooling strategies and how they actually align with your diagnostic priorities. And you need to know what you're more concerned about. You're concerned about missing, let's say, early disease, or you don't want to overwhelm clinicians by false positives, by picking up every single thing that may not be important. So understanding the right pooling strategy should reflect your clinical priorities. Now let's go over this so that we fully understand this. So pooling layers thus reduce the size of the data while preserving most of the important features and the features that we want, right? We may want different features at different stages or different clinical scenarios. We may want to set our AI for different pooling feature characteristics, and see what we need at what time. Think of this as summarizing of a medical image, keeping critical diagnostic information while discarding unnecessary details that we are not looking for. So this makes the models faster and more efficient, prevents overfitting to training data. You can go between high definition to low definition, and it helps preserve all the features that you need. And this is critical for medical imaging applications. Then we discuss this image right over here that we have everything in this image. We don't need everything. We need, let's say, we only need the margins, then we will look at this image. Or we only need to know the average color in that image or density, then we will look at this image. Then we discussed regarding max pooling and average pooling. And you saw that max pooling was getting us a more defined image. And average pooling was not giving us such a defined image. Max pooling keeps the strongest signals in each region, ideal for detecting high contrast objects like tumor edges or bone fractures. And sometimes we know we are looking at a CAT scan and we're not able to, even with the CAT scan, tell if the patient has a fracture or not. In the future, we will have these tools, these AI tools, and nowadays we go and change the contrast on these images and change filters. However, in the future, we will have much better tools to pick up fractures or anything else. Then average pooling preserves overall characteristics of each region, which is better for subtle tissue density variations and gradual changes that a tissue may be experiencing. And pooling strategies are not just technical decisions, they are clinical choices, and they directly impact diagnostic capabilities. So you have to balance between model efficiency and diagnostic accuracy, and your clinical expertise should guide architectural decisions. And consider the cost of false positive versus misdiagnosis. This is always important. So, as we say, the most effective healthcare AI system, they are built through collaboration between clinical and technical experts. This was about pooling. Now, in the next video, we will talk about dropout layers. Dear all, I hope you are doing great and that you are liking these lessons and you are enjoying and you are learning. And I did want to suggest something as an option for you. Only if you are one of those who want to have this content in a more organized manner, there is a program that I have set up that you can find in the description. It absolutely is not necessary. However, it is only for those who do thrive in an organized approach, and there just might be a few more goodies there as well. Anyways, I wanted to share this, and now back to the video. Okay, so dropout layers, and these are very important to understand. So what are dropout layers? This is basically teaching AI not to memorize, okay? So imagine you are studying for a test, but instead of just memorizing answers from one textbook, you randomly cover different parts of each page while studying. So this forces you to learn learn the general concepts rather than just memorizing specific details. Now, that's essentially what dropout layers do for AI systems. And just like a student who would want to develop or understand concepts of what they're learning, this helps the AI machine not just memorize, but actually look to understand and learn patterns. Now, if we would want to provide a simple definition, dropout layers are like a teacher who randomly covers up parts of a student notes during practice tests. When you're covering different parts of your textbook each time you practice, forcing you to understand general concepts rather than memorizing specific answers. Okay, so why does this matter for healthcare? Let's say a hospital in New York trains an AI system to predict which patients might get sepsis, right? Let's take that example. So without dropout, that we take out some values here and there, we take out some features here and there. I'll talk about this. So without dropout, the AI might learn very specific patterns that only work in that particular hospitals. You're not really challenging this AI. So for example, it might notice that the patients discharged on Fridays have higher infection rates in the community, or they come back to the hospital, get readmitted. And this might not be because on Friday discharges are medically risky for some reason, but because the hospital has a specific Friday workflow that affects patient care. And you do not have that in your AI, and you're just looking at the medical metrics. Let's say this AI system is now being used by a different hospital. Let's say it could be a different hospital in New York, or let's say this new hospital is in California, and they're using the AI system trained in that particular hospital in New York. And now the discharge procedure in California is a bit different. And in California, this AI system will fail because it was looking for patterns that do not exist in California. The patterns that it picked up in New York, in that particular hospitals, do not exist in its new environment in California. Now, this is like a student who memorized all the answers from a given Q bank, a question bank. However, he did not understand any of it. And now he is in the exam and he got a set of different questions. Now he's in trouble. He cannot understand, he cannot answer those questions properly. Now, for example, let's say an AI is trained on for heart attack predictions in a large university hospital, and it learns to rely on heavily on expensive tests, or more tests are done to train that AI. However, those tests were not generally available at a smaller community hospital. So with Dropout, AI learns to make good predictions even when some information is missing, making it more useful in different types of healthcare settings. So with Dropout, what happens is that when you're training your AI, you provide them this node, this information, this information, this information. However, you leave out this piece of information. All right, you in this sequence, in this layer, you leave out this piece of information. You have these active neurons, but you have dropped out some neurons. And the connections have to guess, okay, what is happening over here? What is happening over here? And this basically leads to a model that is better trained and a model that looks to think a little bit more. So there has to be a balance. Too little dropout, and the AI becomes like a student who only knows how to answer specific questions exactly as what he has memorized. And too much dropout, and the AI basically becomes like a student who studied with so many different textbooks and different sources, but at the end didn't learn anything useful. And why this matters? Because without any dropout, any AI might learn patterns that only work in one hospital but fail at other hospitals. So in healthcare, the AI needs to be flexible enough to work in different hospitals with different equipments and procedures, but still smart enough to catch subtle warning signs that indicate that the patient may be in danger, even though that patient may be experiencing different situations compared to what the system was trained on. Now, how can a doctor or somebody like you, as the physician or clinician in the loop, how you will use this knowledge? So when you use an AI tool and you understand how Dropout helps, you ask better questions to the vendor, perhaps. So was this AI tested in hospitals similar to ours? And let's say, how well does this work when some test results are missing? And what happens if our hospital does things differently than where the AI was trained at? So these are important questions because they help ensure that the AI will work well for your particular situation. Now, in the next video, we will talk about batch normalization. Stay tuned. My dear friends, I hope you're loving this. I put a lot of heart and soul into these sessions, these how you can be the human in the loop in healthcare. This content is free, and for my efforts, I want to request if you can share this with a quick message that you are loving this or that you are learning so much. Share it and send me a message, and I will personally comment below your share to send you a warm note of thanks. I would humbly appreciate you. Thank you so much. Okay, now batch normalization, and this is making sure that all machines speak the same language, or at least the best that you can, right? So what is batch normalization? Imagine that you are conducting a scientific study across multiple labs, multiple laboratories, and each lab has a slightly different piece of equipment. One measures, let's say, simple example, one measures temperature in Fahrenheit, other lab measures in Celsius. And so one scale is calibrated differently than the other, right? So before you can compare results, you need to standardize everything so that all the measurements mean the same thing. So you need to have all the measurements meaning the same things. This is what batch normalization does for AI systems. Now, let's give you a simple definition. So batch normalization is like a universal translator that makes sure all information going into an AI system is measured and formatted the same way. So, real world analogy. Imagine conducting scientific studies across multiple laboratories. Before comparing results, you need to standardize all measurements so that everything means the same thing. All right, that needs to be important. Now, why is this important, of course, in healthcare? I think you may understand because we know that healthcare data is fairly messy. Different hospitals use different equipment, measure different things in different units, and they follow different procedures and practices. So one hospital might measure blood pressure every hour, while another might measure every 4 hours for a certain medical problem. One lab might report glucose levels in milligram per deciliter, while another hospital might use millimole per liter. This is especially also important, for example, if you are conducting a study or an AI system used in the US is looking to go being used in England, perhaps, where I believe they have millimole per liters instead of milligram per deciliters for glucose levels. So without batch normalization, an AI system trying to learn from data from multiple hospitals or settings would be like a person trying to follow a recipe where some ingredients are measured in cups and others are in liters, while others are measured in handfuls, perhaps, right? So the AI would spend all the time trying to figure out what the measurements actually mean instead of actually learning the important medical patterns. So let's give you a real world example. I think you got the idea, but let's give you a real world example. For example, take blood pressure monitoring. So hospital A uses automated cuffs that take readings every 15 minutes. Hospital B uses manual readings taken by nurses every 2 hours. Now, hospital C has older equipment that gives different readings than the newer machines. So nothing's normalized. So batch normalization helps the AI understand that these measurements are actually tracking the same thing, and that is blood pressure, despite all of the different methods and the timings and maybe even slightly different readings. So let's take lab results, for example. Different labs use different reference ranges for the same test, right? A normal white blood cell count might be, let's say, from 4,000 to 11,000 at one lab, while it would be listed as 4.5 to 11 at another lab, right? So batch normalization is a process that helps the AI understand that these are the same measurements. They're just, and it tells the AI that these are just being expressed differently. So let's look to exemplify from this image as an example of batch normalization. So before normalization and after normalization, you see all these numbers here. Okay, you see all of these numbers here, and you have a 0 to, let's say, 105 perhaps, right? And I'm not going to suggest what they signify, but just to give you an idea. So it removes some of the numbers, right? And what it also did, it is normalized it. All the values have a central 0 and has values before it and values after it. Everything is standardized, everything is normalized to a particular scale that can be used for all the values. And batch normalization standardized different measurements to the same scale, same scale. This same scale will now be used. Now, what does this actually end up meaning? And let's say from the patient's perspective, AI systems can learn from data across multiple hospitals, making them smarter and more accurate. And your care is then not just limited to a specific equipment or procedures at your hospital. Different data can be applicable to your situation. And AI recommendations that are based on broader medical knowledge can also be applicable, if done properly. They could also be applicable to your local practices or the other way around. So how does this affect care? So when a doctor uses an AI diagnostic tool with batch normalization. It helps AI interpret your test results correctly, even if your hospital uses different equipment than where the AI was trained on. However, of course, I would like to caveat that this is going to be a process. And as you, the human in the loop, will be able to ascertain and ask the right questions and look at the specifics, because right now, for example, we're buying a computer, right? Okay, this RAM, this processor, these many gigabytes, etc. This graphics card. So in the future, you will know about the batch normalization processes and what possibly needs to be done at your location, at your hospital, or at your clinic, that you may even need to tweak the model a little bit. So again, that's where you come in, and so you will understand the specifics of that model. So yeah, there you have it. Batch normalization is another feature that you need to be aware of. So in the next lesson, we will be talking about decision trees.